Let's do an anatomy quiz in real time. Let's test what I know using Primal Pictures quizzing app. What do I feel like testing myself on? Maybe the abdomen. And what type of system? I can do mixed. Yeah. And then we can have mixed questions, and let's use multiple choice. What is highlighted? So for multiple choice, I like to hide the answers so that I'm not influenced. And here I can see that it's pretty zoomed in on this model, so let's get a bit of context and see what is highlighted. I'm seeing that the structure is attaching to the pelvis, and it looks like it's attaching at the anterior superior iliac spine. So I think I just want to add a bit more context to the model. Cool, this structure seems like it's quite superficial as well. Okay, now it's been covered by the abdominal wall. Okay, does anyone have an idea? And there's an opening beneath it, which is where I'm going to assume structures are going to pass into the lower limb. I'm going to say that it's the inguinal ligament. Let's see if it's one of our options. First one, perfect. I don't really have a doubt in my mind that this is the inguinal ligament, and I was correct. So next up, what is highlighted? Let's hide the options and let's see if we can get some context. It looks like it's attached to the vertebra. Let's reduce what's seen on the model so I can check it out a bit better. And it's behind the esophagus. It looks ligamentous because it's attached to all of the vertebra kind of running down the vertebral column. I'm actually not sure what the ligament name is. I think I've forgotten. It seems to also expand at the bottom here, traversing all of the vertebra. I'm looking for the words longitudinal, traverse, inter, because it's going between the two vertebrae. So let's see what our options are here. Oh, here we go. Okay, I think I'm gonna say anterior longitudinal ligament because it's anterior, it's longitudinal, and it's ligaments. Absolutely. Okay, we're 2 for 2, but I don't know how I feel about this one. It looks a bit hectic, but it's okay. We can break it down. So what is highlighted here? Let's see. I need to zoom in for this one. Immediately I can see that it's got something to do with the bladder because it's leading up to the bladder. And it's also running alongside an artery here. It looks like it's, you know, kind of the main blood supply to the bladder itself. Everything to do with the bladder usually has the word vesicle in it as a name. So I can almost pretty much assume that this is the vesical vein, or it could be superior, inferior. We've got internal iliac vein, which I don't think it is. This is definitely a branch of the internal iliac. It's not the spleen. I think it's then the superior vesical vein. That's the one that makes sense to me. What is highlighted here? Is it a nerve? Is it a vein? Is it an artery? So it seems that the structure originates in the abdomen and then passes underneath the obturator foramen and moves into the leg. So that's quite interesting and helpful. And one is tested on arteries, veins, and nerves. You can never just look at it in isolation. You can never just look at it at this point and think that you will be able to know which one it is. We need context. We need to know where is it coming from and where is it going to, and where does it pass through, of course. I think it's coming from this lumbosacral plexus, and it's passing inside the obturator foramen and out the other side. My answer is that it's the obturator nerve. Let's see what options are here. Boom! I'm gonna say, did it!